Welcome everyone, I am Réka Petra Tóth, and I would like to introduce myself and my PhD topic, which is Insights to Medical Ventilation. So I am a PhD student here at Semmelweis University, and I envision a future where everyone has access to advanced medical technology, no matter who they are. And in order to achieve it, I would like to improve the effectiveness of current technology. This semester, I've launched 2 projects. One is a systematic review and meta-analysis about comparing 2 medical ventilator modes. And the second one is a retrospective observational study about model-based optimization. So let's start with this first. We know that nearly half of the patients in the ICU are requiring medical ventilations, which is far from having no risks at all, such as ventilation-associated lung injuries or pneumonia. And we could say that the more time they spend on mechanical ventilator, the more likely they are to develop these complications. Nowadays, we are using manually adjustable ventilators, which are incapable to adapt to the patient's needs in real time, since the clinician first has to assess the measurements and set the ventilator according to it. This practice may lead to an elongated duration of ventilation and an increased rate of complications. However, nowadays there are available new system, new modes that are capable to basically do within breath or breath-to-breath analysis and set the ventilator according to it. By that, we hope that we could reduce the duration of ventilation and increase complications as well. Even though we have high hopes towards these systems, we are still lacking of evidence. So I would like to investigate it further to find out how useful they are. My clinical question is, are adaptive modes more effective and safer than conventional modes? I would like to use a PICO framework for that reason. The patients would be invasively ventilated. Other patients, I would like to compare adaptive modes to conventional modes, and my primary outcome would be duration of ventilation. And I hypothesized that adaptive modes significantly reduce the duration of ventilation of invasive ventilation, of course. And by researching this field, I hope that we could shorten the time of ventilation, we can have a more lung protective approach to it, and also improve patient comfort as well. For our systematic search, we conducted it in 3 databases, PubMed and Bayes and Cochrane Library. We use 2 domains, one for adaptive modes and one for conventional modes. Here you can see my search keys. The first table shows the breath-to-breath analyzers, namely the adaptive support ventilations. And the other one is the within-breath analyzers, proportional ventilation, and the neurally adjusted ventilator assist. Now I would like to show you our preliminary forest plot, where you can see with highlights our within-breath analyzers, all of them comparing the duration of ventilation in adaptive mode to conventional modes, measured in days, expressed in median, and the effect was measured with mean differences. And as you can see down below, our finding was significant since it favors to the adaptive modes around 1 day. First, we conducted our research. We conducted the research, and we ended up with